Firstly, we have medical management. This is where hormonal therapies come into play. Think birth control pills, GnRH agonists, and progestin therapy. These treatments work to regulate hormones, which in turn can manage the symptoms of endometriosis. They can reduce pain and also slow down the growth of endometrial tissue. The choice of hormonal therapy often depends on the severity of the symptoms and whether the woman wants to get pregnant in the future. Next, there's surgical intervention. This is typically recommended for women who have severe endometriosis or for those who have not found relief from pain with medical management. The most common surgical procedure is laparoscopy. This minimally invasive surgery involves small incisions in the abdomen to remove endometrial tissue, cysts, and adhesions. In more severe cases, a hysterectomy, which is the removal of the uterus, may be considered. This option is usually reserved for women who have finished childbearing, or if the pain is so severe that it significantly affects their quality of life. Finally, there's what we call a multidisciplinary approach. This comprehensive treatment combines medical, surgical, and complementary approaches. It may include things like physical therapy, dietary changes, and stress management techniques. The goal is to not only manage symptoms, but also improve overall health and well-being. This approach is highly individualized, taking into consideration the severity of symptoms, the woman's reproductive goals, and her personal preferences. So, to summarize, the treatment options for endometriosis include medical management with hormonal therapies, surgical intervention with procedures like laparoscopy or possibly a hysterectomy, and a multidisciplinary approach that blends medical and surgical treatments with complementary therapies. Each of these options has its own benefits and considerations, and the best course of action depends on individual circumstances. Remember, if you or a loved one is dealing with endometriosis, it's crucial to have open, honest conversations with your healthcare provider about your symptoms, your goals, and your treatment preferences. It's a team effort, and you're an essential part of that team. Your voice matters in shaping your treatment plan. With the right information and support, you can navigate the journey of managing endometriosis more confidently. Remember, you're not alone. There are resources and communities out there to help. Reach out, ask questions, and don't be afraid to advocate for your health.